Hi, I'm Dr. Jessi Gold. I'm an assistant professor in the Department of Psychiatry at Washington University in St. Louis School of Medicine, and also the Director of Wellness Engagement and Outreach. I am here and excited to have this conversation with Dr. Farah Fourcand about everything that is mental health and her experience in being in healthcare over COVID and anything else that comes up. I think maybe it's best to start with maybe you introducing yourself so that I don't completely make it up. How about that, Dr. Fourcand?
So I'm Dr. Fourcand. I am a board-certified neurologist. I trained at the NIH. I did my stroke fellowship, then neurocritical care fellowship, and now I'm doing neurointerventional surgery fellowship. So I do, the whole 360 picture of patient care, and I love it.
That sounds like a lot of training. What does day to day look like for you?
Things are always in flux. There's not a lot of predictability, which I like for the most part. But I do cases during the day, whether that's elective procedures or interventional procedures like coiling aneurysm or stenting carotids or doing stroke thrombectomies, and then during the day we may 4 or 5. We usually have somebody come in with a code stroke because it's always like the witching hours. There's different times, there's the wake up stroke, there's the 5 p.m. stroke, there's different things. And then we always go for it. We never say no, hardly ever say no. We only say no when it's not in the patient's best interest. We do a lot of self-sacrifice.
Where do you think that self-sacrificing mentality comes from for you, for other healthcare workers too?
I'm not sure where it comes from in others, but for me, it just comes from my upbringing and also being one to self-sacrifice and really give my all and not expect anything in return and do something for the sake of doing what I think is right. If not only what's right, but doing what's within my capacity to help to do. Because obviously I can't do most things, but at least there's a little sphere of ability I have that I know is helpful. And, I've just always been one to do that since I was younger. And, it comes with its the barriers, because sometimes I give, sometimes I do sacrifice too much, sometimes I do take on too much. So I'm working on that.
It's a hard thing to work on, but an important thing in saying no too.
Yeah, I have a hard time with that.
I think that self-sacrificing mentality comes in for a lot of people in medicine, that we were raised a certain way and maybe medicine preyed on that with how they teach you in school. I'm curious then how you even know when you're at your limit or when you need a break or when something is too much.
I think I recognize it, but I kind of internalize it and I think it through. What's the risk or harm to me? What's the risk or harm to somebody else? And usually, I push through. I can handle a lot, and that's good because that's what's kept me kind of happy and being able to do other things in my life aside from this, even though it's a stressful field.
I think if you think about that whole kind of putting your head down and just doing your job and being able to handle a lot,
that's a good way to summarize it.
Yeah. Do you feel like that came in a lot over the beginning of COVID and sort of how that played out for you in your workplace and what you do day to day?
Meaning just keep your head down and go for it and do it?
Yeah, sort of like this, okay, this is new, this is hard, this is different. I think I'm just supposed to help people. It's scary too, but I'm just going to go for it and do what I'm supposed to do because that's my job.
Honestly, I think we had our group had a unique experience that wasn't exactly that. Because just a little background, we do neurointensive care and that's our sort of our happy place. But the pulmonary and medical ICU physicians were very overwhelmed with what was going on. So yeah, I volunteered, and we sort of made a plan of supportive care that could get everyone through the process, hopefully. So we tried that. We made a plan. We tried to be positive. Every day I'd come at 6 a.m., see all the COVID patients, go in their rooms, and see the pretty demoralized nurses and staff who were really, really affected. And we thought that it was such a dark place, and so many patients are sort of like have a scarlet letter, and like once they're intubated and they're here and they're in renal failure on dialysis, it's game over. Like, okay. So what we thought was we would try to extubate patients, like as many patients as we could, which was a big deal because like nobody was being extubated at that point. So we like evaluated patients who we thought may be fixable, even though they were really sick. I mean, they were on the ventilator, they were like renal failure, they were in heart failure, like they were really sick. But there were like things we could tweak over like the next week or two, because it's a day by day thing in the ICU, to get them there. And it ended up being that we were able to extubate the 5 patients in one day, which it seems like nothing, but it's actually a lot. It was such a morale booster. Everybody knew about all those patients who got extubated. And I was like, oh my God, finally good news goes around. And because it's always gossip and like negative stuff that like spreads like wildfire, but it was like actually something positive. So, that was really cool. That was one of the best days of my life. And I think, we took the pandemic as a challenge, and obviously one that we figured we have no business fighting, but we were there and we wanted. And it's like you're in a situation where it's going to be the way it is, regardless. It's all about the way you handle it.
I appreciate you talking about that. I think it's hard for people to talk about a lot of these experiences, but so important for people to hear. So I truly appreciate it. I think one of the things that you mentioned that I think is interesting is like at the beginning there was a lot of death, and even if you're in a field where maybe people are exposed to more death, like I've heard it was different, and the way it felt for people was different. And I was wondering if you could talk about that some.
It was very different. A lot of it is because I think a lot of it is that we are used when a patient dies, who's very sick, whether it's an acute thing or something chronic, and there we have an understanding of why, like at least we think we do, have an understanding of why it happened and why it's happening, and we can explain it. I wonder if we can almost intellectualize things to help us understand why this happened. It's terrible, but it happened. But I think for a lot of physicians, especially ones who are more experienced and have, feel like they just have things on like Rolodex in there, having the unknown completely just enrapture everything, and for somebody to just fulminantly pass without feel the feeling of not being able to do anything, really makes physicians uncomfortable. But they were, a lot of nurses obviously left, and there's been doctors who specifically left because they're like, I can't do this, I'm done. And they're not ill. They're old. They're middle-aged. They have many years ahead of them, but they just have left. But there were some things that everybody was really perplexed and had no answers, and that makes a lot of doctors uncomfortable, like the unknown. And because I think a lot of us go into medicine because it's something that you can see and feel and you can understand, and there's a way and process in which things work. Trying to explain things, the ambiguity of things makes some uncomfortable. So I think a lot of that was hard.
So you mentioned in the nurses, you're seeing a lot of nurses who felt disheartened, and some nurses who left their jobs. I'm wondering, in the physicians and the nurses and you, how this affected your mental health.
As much as, especially in our field, we acknowledge mental illness. Of course, it's something that I so wish was not taboo. And even, as much as it's one of those things that you say isn't taboo, but it's tabooed, it's just complicated. But I think a lot of it was more delayed. Like I know some colleagues who like I was honestly surprised at like certain things that they were doing or certain things that they were not doing. And I didn't understand why, but then eventually they would say that, it really affected me. It really messed with my head, and really, I felt responsible. And I like that blew my mind, because I think that what we did was good work. I mean, we tried our best, and I think it was a terrible situation anyway, and I feel like we gave our all. But to see people who had a similar experience and feel like responsible for it, or feel guilty for it, or feel like they should have, I don't even know how that's something. I feel like that sucks. That sucks to feel that way. And I think that it was very delayed in communicating that, but I'm pretty sure they felt it. They just felt like they can't say it, because you always have to be in a place of strength, But with regards to how I see death before, during COVID, and then now, I mean, I hope it never dissipates. I think at this point it probably won't. But I have a lot of empathy, and I feel a lot. I cry. It's interesting. I actually cry for the littlest thing. I've always been that way since I was a little girl. And I do it even when I look at a patient sometimes. But I remember some of my colleagues saying, "Oh my God, are you okay? Are you okay? Okay, are you okay?" Like in general. But I told them, no. This is not like crying. Like the crying. It does not limit my ability to work or hinder me in any way. It's just something that happens, and I let it happen. I just let it happen. It's like something, my amygdala just does it, and then I get back to work with more motivation to do what made me cry, with more intensity. So I've never seen it as a negative, and I never tried to stop doing it, because I feel like it's a good sign. It's a good sign. So it still happens every day, and it makes me realize that I haven't lost that.
I mean, I think when you talk about crying, I can think of a lot of people who don't do that for fear of what it means about them, or we spend so much time really trying to compartmentalize our feelings. And I wonder, you also talked about people who kind of really waited a really long time to even say, like, hey, this feeling that I'm having turns out making me burnt out or depressed even, and making it so I can't do my job. And it took a long time to get there. And so I was just curious whether you felt like those are linked, or what the culture of medicine says about emotions and help seeking.
On paper, it says, yes, we should, definitely advocate for our well-being and be very open and transparent. But the reality is different, and a lot of us don't keep it in and don't feel comfortable. I think a lot of us have emotions, we just deal with them differently, and that's outside of medicine, people outside of medicine too. But I think a lot of it is that people see us I think they see us a little bit differently. Certainly people treat me differently when I go out and somebody just talks to me, but when I see what I do, they act different, as if there's some sort of difference there. And I think if we are humans, we want to connect. We want people to see us as vulnerable. I want people to see us as vulnerable. We're just people, and we just have a particular interest and, knowledge, little fund of knowledge that does something a little bit different than what other people do. And maybe we have different personality traits that help us do that. And maybe it's aptitude-wise, we are good at certain things, but we're just people. And I think if we felt that others just saw us as just normal, flawed people, we would be a lot more open to expressing ourselves. We're held to a different standard as far as, what we can do, what's acceptable, what's this, but we're human, and as much as somebody may say they're okay with this or that, they're not. It's just, it'll take a lot of work on many of our ends to actually make that happen.
Yeah. You think that view of us not being human makes it so people don't get mental health help when they need it?
I think so.
Was that ever a problem for you? Did you feel like over COVID, I'm crying more than I usually cry, or this doesn't feel like it's just normal reaction to a pandemic where there is no normal reaction? and it felt like something that you needed to, talk to someone like me for?
Thankfully not. And I thought about it because I'm wondering, am I like not understanding myself? Am I not being insightful enough to recognize any? I thought about it because I see that it's something that has affected a lot of people. I mean, everybody, like, is very much affected. But I think a lot of it is my upbringing. I had a difficulties, and I like in my environment. So I became very resilient. I'm very resilient. Like, so I mean, it was terrible, but I really, no, I feel not the same. I feel okay, I think it's more whenever I mean, I work hard. So sometimes like today I am extremely tired, like beyond tired. But I mean, I am lucky enough to not have had that experience, but I like not to, but I really, if it came to it and something else happened, or if something else affected me, I don't know, because you never know. It could be something tomorrow. It can be something. It doesn't have to be a huge world-changing thing to make somebody have that moment where they're like, man. So it could happen anytime. It could be one experience that just really, I've seen a lot of things in my short time on this earth, but there's certainly something I know not inevitably, but I know there's something out there that would do that to me, So I'm just grateful that I didn't have to, that was not another burden, because it's a burden to carry. And it really is. And I feel for a lot of people who have that burden and are like putting it off, even acknowledging it, but then just acknowledging it. Well, that's one step, but actually taking steps to do something about it. I don't even know anybody who's done that. So Dr. Gold, I have a question for you. Out of the group of doctors and nurses who have been brave enough to, acknowledge they need help getting through the pandemic, what has been the worst outcome and presentation and the best outcome and presentation?
It's really interesting in that group, like in healthcare workers, a lot of people wait to get care and they're pretty bad off by the time they actually get help, in part because they were really, really trying not to have to ask for help, or there were, a lot of barriers to it, like stigma or their own cultural beliefs, or they thought they could handle it on their own. I think I'm in a unique position because I'm a medication prescriber, where sometimes people come and they say, like, just give me a pill and make it go away. Like, I just want to sleep. I just want to stop being anxious. I just want to, like, can't you just give me a pill? And I wish I could do that in some capacity, but it's so much more complicated than that. So sometimes people are already pretty bad off. But if I was to think about kind of the spectrum, I mean, I think some people do notice early that it's interfering with their life. I think, worries and sort of like, I'm thinking about the pandemic too much outside of work, and I'm not socializing, or I'm snapping at my kids is pretty common. Like, I don't have a lot of time with my children and I go home and I'm not nice, and I don't like that. And like, what is this? And do I need to do something about it? I would say is a pretty common earlier kind of sign, as well as like, I'm not sleeping or I'm not concentrating in sort of like a short-term stance. In a longer term, like harder cases, I mean, I definitely have healthcare workers who can't go in rooms that they used to see COVID patients in because they get flashbacks. I have healthcare workers that get panic attacks in the parking lot of the hospital. I think that they're, unable to work for some amount of time too. I think that is common. I've done a lot of partial disability, like, short-term disability paperwork. I think less so that like I'm having a lot of people leave their jobs, but I do think that that's a really common thing for people too, which is like this has just been too much, or I don't feel as connected to what I'm doing, and I need to not be doing this anymore. And I don't know what that looks like forever, but for right now, it's not right for me. And I think that's why we're seeing people leave. And so that's definitely an outcome I've seen too. One of the things I noticed when you were talking about like the beginning of the pandemic and how you dealt with things, like you have a lot of like reliance on meaning and purpose. Like I can help with research. I can help extubate someone. That is a purpose I can give, and I can give myself meaning in this day. Like, is that something you know you do? And if so, like, where does that come from? And if not, do you have other coping skills that kind of like, you're using actively?
So the doing something for a sense of purpose, it's like, I think it might have been at some point learned or acquired, or I don't know if it's something I was born with, but I have always been that way. And it's something I think is subconscious now. No, it's a good coping skill. Like, it can overextend you, because then everything has to do with a sense of purpose. Sometimes you need to recognize that, because that can lead to issues. But no, it's not on purpose. No pun intended.
Are there other things you turn to, like that that you do for coping, like when you're having a really hard day?
Oh, yes. I always say, whenever I am thinking of complaining that, I'm a young woman, I could be doing this or that, or, not be here having a good time like my friends do or whatever, I think, who am I to complain when everybody around me is going through the worst time of their life? And in what I do, this is the worst time of their life. They're having a stroke, they're bleeding in their brain, or they need some sort of, this is bad. Who am I to complain when this is the worst time of their life? To have that insight, and it's contagious. The complaining thing, where I'm tired, we're overworked, we're not, and it spreads, and it's toxic. I personally, I think that I do on purpose. Of course, I have a right to complain when but when I think that way, it turns it off, and I realize that I have no business making this a mountain out of an anthill.
I'd like to thank Dr. Fourcand for giving her time and, being able to be so vulnerable. It's one of those things that's not always done in medicine and needs to be done, because it changes culture in the same way where we talk about us being human. Every person who's more vulnerable will make us more human and seen as more human. So thank you so much for that.
Thank you, Dr. Gold, for taking the time to ask me all these poignant questions and listening to me ramble on and on and on about them. But it all came from the heart and the brain a little bit. But I just think the whole point of this is to make us seem, or to just for people to recognize that we are human, we're vulnerable, we make mistakes, we're flawed. That's okay, and help us accept that, because I think we need people's help as much as they think they need ours. We need that so much more sometimes, and that would make all the difference in the world. And I hope it's something that, if anything, a few maybe good things have come from this. I hope that's one of them.